Hey everybody, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today, you may remember this familiar face that we're looking at right here. We are talking again with Dr. Patrick Carroll. He's the Chief Medical Officer of Vida Health. And we met him a few months ago. He came out of Hims and Hers, where he helped take that company public as Chief Medical Officer, worked at Walgreens. And when we met him, he teased us that Vida Health might be launching some prescribing services. And 3 months later, here we are to talk about it. So, Pat, great to have you back here. Exciting news.
Yeah, great to be back. And I'm really excited about sharing our news with you and your audience.
Well, I mean, like seriously, hey, 3 months and it's like here it is already. Wow, moving pretty quick here in the new job. So why don't you tell us all about this? Because this is actually really big news as far as Vida Health is concerned, and as far as the digital health chronic condition care space is concerned. So prescribing services for some cardiometabolic disorders as well as mental health, both at the same time. So unpack this for me. Tell me what's going on over there.
Great. So let's start with mental health. As you know, Vida's been in this space for a long time. We're a true believer that the mind and body is not separated when we talk to chronic care conditions. And so for mental health today, we have really valuable services. We have coaches and counselors, and we follow patients longitudinally through their care journey. Someone comes on our platform, they're screened for PHQ-9, GAD-7 to gauge where they are in terms of depression and anxiety. We do social determinants of health screens. And so we collect a lot of information and data about what their conditions are and where they need help. And we get them plugged into our whole health or specifically to our mental health program, help them through their journey with counseling, support, coaches. And what we realize is that for the majority of our customers, that works. And if you actually look at the literature, counseling and coaching based on improvement through your PHQ-9 and GAD-7 for anxiety and depression, 70 to 80% of the time is really impactful in it and is effective. But there's 20% of patients with moderate to severe depression who absolutely could benefit from medication. So really, in order to kind of complete that quality of care loop and to offer a full range of services, we were intent on launching prescribing services. Now, to be very clear, this is just building on a really high quality platform that we've already developed. This last mile is specifically for anxiety and depression. We're going to partner with, to start with a large employer that we collaborate and work with, who has requested these prescribing services. Why? Access to mental health prescribing into medication is a real challenge. Today, it can take months before you can get hitched up with the prescriber, and then to get the medication and to have it followed on the same platform where your counselors and coaches are, we think is hugely valuable. And so what we're launching with that employer is for selected patients, those who we see that have moderate to severe depression that either aren't improving or our counselors, our therapists identify could probably benefit from medications. They'll be referred into our providers. These are Veda employed providers.
Okay.
We've actually hired a full-time psychiatrist to oversee this program, Dr. Christy Vo. She was formerly at UPenn and had done virtual mental health there for several years. And we have other providers that we've hired and bringing on so we can scale this nationally. To be clear, it's around anxiety and depression. We are not going to touch controlled substances.
Okay.
That is not our intent.
Okay.
It's not in our game plan. Customer will get referred in through our therapist. We'll actually ask very specific questions about where they are in terms of their mental health journey, make a determination about whether they could benefit from medications, and then they'll have a synchronous visit that's face-to-face with our prescriber. At the first visit, a follow-up in 3 to 6 weeks that's synchronous, and then regular asynchronous follow-up. Through their care journey, we're going to be following the PHQ-9 and the GAD-7, adjusting medications, and we will assume, their total mental health care from coaching to therapy to care managers to prescribers. And we intend to connect back to their primary care provider to inform the primary care provider that your patient is now engaged with Vida around mental health care, and we're prescribing these medications. So we want to keep the primary care provider in the loop.
Yep.
Honestly, as a primary care provider of 30 years, I had a difficult time accessing prescribers for mental health conditions. So I think it will be a benefit and it'll be welcomed by the primary care providers as it is, needed and requested by our employer partners. So that's on mental health.
Yeah, so let me stop you right there real quick because
Yeah.
I feel like there have been a lot of careful delineations here that you keep going back to, Pat, over and over again. So the reliance on the GAD and the PHQ-9 and those quality metrics that are in place, and then also the fact that this is strictly for depression, anxiety, no controlled substances. And I know I'm calling this out because there's been a lot of news lately about some actors that have gotten into some trouble in this specific area, specifically around virtual mental health delivery. And so those are the things that you guys have in place, correct, to make sure that none of the patients are put into any risky type situations with the medications that they'd be receiving from your doctors, correct?
Yes, absolutely. And today we already have that quality structure in place because we're delivering care through therapy and coaching day in and day out. So we have that, and to add on the prescribing is not a really heavy lift for us other than bringing in the network. And the nice thing is it's all on one platform such that the prescriber is actually communicating with the coach and the therapist. So we're all working together. That's very, very important when it comes to mental health care. And we'll follow the patient through their entire care journey, whether it's just as we do today with coaching and counseling, and when we add on the medication.
Okay.
So we feel that, our focus is on the cardiometabolic conditions and mental health. And we've seen such an impact if someone is depressed in terms of them actually improving on the cardiometabolic condition, there's a direct link. So that's why we felt that this was the natural progression of what we do. To really improve the cardiometabolic, you have to manage and improve the mental health condition at the same time. And the prescription piece will just really allow us to do the full scope of care.
That's amazing. Okay, and now talk to me about the other side of it, because like we said at the top, Vida Health, always well known for being integrated mental and physical health from the start. So tell me about the cardiometabolic side. What does prescribing mean on that side of the care that you guys are offering?
So, we're not going out with a full scope prescribing for diabetic meds and for hypertension. I think we'll eventually get there. But to start with, we've focused on a few areas. One is we are really focused on CGMs for our patients who are on insulin for diabetes. Continued glucose monitoring has become the standard of care. You need a prescription, believe it or not, for CGMs. So we have developed a provider network that can actually prescribe CGMs in 50 states. So if we have a patient that's on either once a day insulin or multi-dose insulin, our monitoring device of choice is going to be continued glucose monitoring prescribed by our provider. And our platform already can ingest all that data. So it really gives our CDCSs, our dietitians, and our coaches better data to act on and to make suggestions to that patient. So that CGM is one thing we'll be prescribing. The other is we have a kind of an intensive dietary program. It's called medical nutrition therapy. In some states, a prescription is required. In the past, that was kind of a block for us if we couldn't get a prescription for the medical nutrition therapy. With our prescriber network now, we'll be able to do that. And then the third piece is we identify, customers with diabetes who do not have hemoglobin A1Cs that are recent or updated. And so today we have to go back to the primary care provider and say, please order this, your patient is due for this. As a matter of convenience and a matter of improving the quality of care, our prescribers will now prescribe lab tests. Awesome. That will be for mainly hemoglobin A1Cs, but also capable ordering lab tests for things like lipids, because we manage lipids and hyperlipidemia on our platform currently. So are we jumping into managing and changing diabetes meds and maximizing the dosage of their antihypertensive meds? Not today. We are looking at that in the future.
Okay.
All of this is going to be in conjunction with the primary care provider. We don't want to disintermediate them. We communicate with them on a regular basis today through our coaches and counselors. And as our prescribers get more involved with their care on the mental health, as well as the lab ordering and the CGMs, we're going to continue that communication with the primary care provider. We want to be part of that patient-centered medical home.
All right, say a little bit more about what that relationship looks like, if you can. And I mean it more from like less on the patient side, but more on the provider interface side. I'm curious about how that looks. So it's like, I mean, I'm imagining like, the Vida Health member who's got the mental health services that you guys are providing. Maybe now they're taking on a prescription drug for their anxiety or their depression based on what you can offer now. They've also got, let's say diabetes, and now they've got a CGM that you guys have helped them prescribe. They might be getting their new A1C levels. What does that look like from the primary care provider's standpoint? Like what kind of information are they able to glean from the types of data that you're collecting on their patient within your platform? And how does that interface look? I mean, you keep saying that the primary care doc is going to be integrated in, but like, I'd love to hear just like, some of the detail about what that looks like.
Yeah, today, in an omni-channel way, we give information to primary care providers every day off of our platform. So, the services we offer, for example, on cardiometabolic, it's not just about talking or communicating to the primary care provider of the dietary counseling we're giving their patient or what type of diet we're putting them on. But we also have pharmacy support services that we contract out. And if someone's on a GLP-1 medication and that needs adjustments, or is on insulin and we see the hemoglobin A1C is not optimized, we actually offer specific suggestions to providers around, you may want to make these medications adjustments. So we do that today. That is nothing new for us. I think it's just adding more information in that communication to providers. It's through, faxes, emails, they're HIPAA protected. Every way that we communicate with them, any way that they preferred, we do that today, and we're going to expand on that because we're going to have more information for them. Not only on the cardiometabolic. If we order a hemoglobin A1C and we get a result, we want to share that with the primary care provider. Also on the mental health, we're going to be telling them, this is what's going on with the coaching and the counseling, but now we're adding in an SSRI because your patient has moderate depression and we think they'll be responsive to it. And we'll give them regular updates on what we've seen on the PHQ-9 and the improvement of the depression on the medication. So it's really just using the current workflows we have in place to communicate with primary care provider and adding more information in as we're doing more on the prescribing side.
Okay. Now, Pat, what does this do for Veda, the business? Because I mean, like, this sets you up for a lot of options in the future. And I mean, as you said, you guys have, physicians now that you're working with across all 50 states. So, I mean, what does this set you up for moving forward in terms of, being the chronic care, fully integrated mental, physical health care provider, outflanking maybe Omada, outflanking Teladoc, Livongo? Like, I mean, how does this set you guys up in terms of differentiating yourselves further?
I think the most important part to us, Jessica, is that does it improve the customer, the patient experience? We absolutely think it will. And the other piece is, how does this, fit in with what our external customer demands are? Employers are coming to us and asking for this. What they're seeing is that they really need to get their employees engaged in their own health. Their employees are struggling with cardiometabolic and mental health conditions, and they're having a heck of a time accessing the care they need. So we're just expanding the care access for their employees, and for the payers who we're partner with, it will be the same scenario. So it's really just offering services that they're asking for. We've been very deliberate going into this space, and we've done it right in the past, and we're going to do it right when we go into the prescribing. It's really built on a quality structure that's already in place.
Pat, down the road, do you see this, like, does Vida Health get into primary care? Like, I mean, it's like, and I have to ask that because I feel like there's a lot of virtual care companies, whether they're in the digital health side, the chronic care side, or even some of these care navigators, like an Accolade, they're starting to get into primary care. Is this something that you think is on the horizon for Vida?
I think on the horizon is we'll get into virtual chronic disease management care. And
Okay.
so focus on mental health and cardiometabolic. I don't see us ever doing really the acute episodic care kind of retail health standard. I've got a cold, I've got a urinary tract infection, come to Vida Health for that. That's not our focus. And that's not what we've built the company for. It's really around chronic disease management, particularly cardiometabolic and mental health. So I could see us expanding prescribing services in those specific areas. For mental health, that prescribing service we're going to offer on anxiety and depression, we're going to stay in that space for a while. I don't see us expanding that anytime soon beyond
Cool.
that, certainly not into controlled substances. For cardiometabolic, we have a clear roadmap that in the future, as we develop a larger provider network, we can do more in terms of prescribing medication adjustments and working in conjunction with the primary care provider to deliver those services for cardiometabolic conditions.
All right. Last thing for you. So we just met you 3 months ago, already back with some big news. What's your next trick? What are you going to do? What are you going to do with the next 3 months?
Jessica, this is enough work for me
enough?
right now, let me tell you. But, you know, we're moving quickly and carefully.
Clearly.
And we're excited about these services, and we're most excited that we really think it's going to help a lot of people out, and it's going to be really beneficial to our customers.
All right, cool, Pat. Well, we'll leave it there, and I'm sure you'll be back with news before we know it. I mean, I'm impressed 3 months in.
Thanks,
Congratulations on rolling this out. It's really exciting news. And I think, like you said, I mean, the end goal here is to benefit the patients with that fully integrated experience. And it sounds like what you've added on here is really the next step in providing that. So congratulations on that.
Thanks.
All right, good. Performance review. We'll have to talk to Stephanie Telenius, your CEO, here soon and find out what she thinks about how you're doing. I'm sure she's got nothing but great things to say. All right, Pat. Well, we'll check in with you soon. Thank you again for sharing the news with us here. It's exciting to hear how, you know, the different businesses in virtual care, digital health, specifically on this chronic care side. I've been following this for a long time. And so to hear how, you know, services are being added on, you know, things are becoming more vertically integrated. It's exciting for me to hear how the models are evolving. So I always appreciate good news like this. Thanks a lot.
Thanks.
All right, for more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. That is youtube.com/WTF Health. Dr. Pat Carroll, CMO of Vida Health. Thank you again for joining us. I'm Jessica DeMassa. We'll talk to you guys soon. Bye.